Erectile dysfunction is the most common reason people walk into my office. I'm Dr. Joshua Gonzalez, a urologist and sexual health expert. Now, you've probably heard of Viagra, that little blue pill, sometimes called sildenafil. But did you know there's an entire population of men out there that don't respond to Viagra or Cialis or any of these oral medications that we use for erectile dysfunction? Luckily, there are other treatment options available for these men. Today, we're going to talk about alternative treatments for erectile dysfunction other than Viagra. So for men who don't respond to oral medications, they have the option to use injectable medications that go directly into the penis. So you use it just prior to sexual activity by injecting using a very small needle. Now, I know what you're thinking, trust me, doesn't hurt. These medications, like Viagra, vasodilate, meaning they open the blood vessels that allow blood into the penis for an erection. And it often will give you a firmer, more reliable erection than Viagra. Sometimes men don't respond to Viagra because of performance anxiety. And this is something that's probably best treated with therapy. Working with a therapist can help identify some triggers that can result in poor performance in the bedroom and make guys non-responsive to Viagra. A new and exciting treatment that I offer in my office is low-intensity shockwave therapy. This is a regenerative, energy-based therapy that involves delivery of shockwave energy into the penis, which then recruits new blood vessels to the area, promotes proliferation of smooth muscle cells, which both allow for regeneration of erectile tissue and better performance in the bedroom. Now, in the most severe cases of erectile dysfunction, some men might not respond to any kind of medical therapy or even shockwave therapy. Thankfully, there's a treatment for them. So you can undergo penile implant surgery, and this is really helpful for guys who have really significant vascular disease that prevents them from getting an erection. Now, this is a penile implant. It involves 3 components. You've got 2 cylinders that go into the erectile tissue, a pump that sits in the scrotum, and a reservoir that's filled with fluid. These are all connected through tubing, and when you want to have sex, you reach down into your scrotum, pump this little ball up, and it draws fluid out of the reservoir into the cylinders until, voila, you've got a rigid erection. Erectile dysfunction can be extremely debilitating. If you're not responding to Viagra, there's options out there. It's also very common, so you shouldn't feel alone if it's something that you're struggling with. So go and see a specialist like myself, somebody who specializes in sexual health, to talk about treatments other than Viagra that you may be a candidate for. We definitely have more content coming at you about erectile dysfunction. So if you like this content, subscribe and stay tuned for more tips from the Dick Doc.